All right. This is Masara Iwas Ransom, the traditional health worker liaison with Trillium Community Health Plan. I have here with me Brandy, who is our Director of Providers Network. And also I have with me Lauren, who is the Director for Case Management, who you might have remember that we talked about case management before, and she told us all about case management at Trillium. So I'm gonna give them the floor to discuss with us what single case agreement looks like with Trillium.
Thank you. This is just a little background here, our special CCO session at the Multnomah County Collaborative. We have both Trillium and HealthShare here to talk about our topic of the day. The file cabinet on GroupSite is where we post these presentations and where we post any follow-up Q&A. So please use that as a resource going forward for yourself or to share this with your teams. Today's topic is accessing care and possibly prescriptions outside of your region. So thank you, Masara, for being here and for Trillium going first.
Excellent. Hello, can you guys hear me?
Sure can.
Excellent. Hi, this is Lauren Dion. I'm the Director of Case Management with Trillium Community Health Plan. And we were posed the question, kind of in general, how to request a single case agreement from Trillium. And, kind of folded into that question in general is how to see a provider outside of the assigned CCO network in Oregon or out of state. So that's kind of a general question. What if a member is temporarily displaced due to a variety of reasons? The example was a fire, the wildfires. If the member is in network area, but one organization or agency that they would like to see is not contracted with the CCO, and then some general scenarios. So each one of those has a little bit different door, but as if you attended our last session and learned a little bit about Trillium case management and Trillium care coordination components, we really stress that there is a no wrong door approach. So I'm going to lead with the fact that if any members have challenges accessing care for any of these reasons, your number one resource will be either contacting customer service or contacting case management to assist members and providers and community relations folks, as each one of the situations is unique. So that's what I'm going to start with. And so if a member is temporarily displaced, and they can still be covered if they need to have a prescription filled outside the area, they're more than welcome to go to any pharmacy and present their Medicaid card and indicate that they are filling or refilling a prescription for medication, and that would process through just like any other pharmacy or prescription refill. What I would recommend in general is that a person, a member or community relations or provider recommend or drive a member to a pharmacy they are already accessing. Example, Walgreens is just a general pharmacy. Because if you switch pharmacies, sometimes it's more challenging to access historical pharmacy records. So say you're going for a refill or an emergency refill, those types of things. Those are all available in emergency situations in which a member, needs to access prescriptions that maybe were left behind in a quick evacuation or burned in a fire, those types of situations. So when we were going through our fire emergencies earlier in the summer, Trillium really helped navigate a lot of members through a variety of situations to access medications, through routes that are not typical, including even getting prescriptions delivered to, assisting members in getting prescriptions delivered to like a hotel or a temporary lodging situation that they were in after the evacuation. So I'll kind of pause only because since there's different processes, Deanna, I just want to maybe pause and say, is there any questions specific to that? Because when I move on to the next topic, it's going to be completely different.
Okay, great. So this is a time for, and right now you were really just talking about prescriptions.
Prescriptions,
right?
yes.
Okay, and you were suggesting to go to the same chain to make it easier. So
yes.
And so I'm looking for questions right now. I don't see any, but I will invite questions. What questions do you have about prescription access, and this is for Trillium, outside of your CCO region? You might have questions about pickup, you might have questions about delivery or process. But I also heard the no wrong door.
Yep. So if if there are questions specific to a member situation, always the recommendation is get through to customer service who can facilitate any prescription fills, or if there's more complicated components, then we can get over to our case management department to really dig in and look for problem solving for a member specific component.
Right. I don't see any questions right now. So if any come in, I will let you know. Why don't you move on?
Yep. So then the next question that I'm going to kind of tackle is the in-network area, but an agency or organization that is not contracted with the CCO. So again, always recommend getting connected with case management or customer service to ensure that we're getting, each situation is unique and we can look at each one of the factors. However, in general, if there is an in-network provider available, that would be the preferred route for the same service. But at times there are not, or at times there's a continuity of care component. So what we would want is the primary treating physician, that should be an in-network provider, to put in a prior authorization request for an out-of-network service. That kind of kicks off what we call the single case agreement process. And then that particular primary treating physician would have to discuss why in their authorization the necessity to go out of network when there is an in-network provider available. And that is reviewed through our utilization review department. And when authorized, which many times they are, we work with our provider network group, and which is why Brandy is on the phone to support getting a single case agreement with those providers. Oftentimes there are negotiation pieces in the background for rates, duration, member-specific situations, but I'll kind of hand it off to Brandy to explain any other components.
Yeah. Hi, this is Brandy Hillman, Director of Provider Network. And just as Lauren was describing, once her team kind of hands off the request to us to work with the provider for a single case agreement, we work with that provider for terms of that agreement for services for that member. And so we ensure, in working with Lauren, that the member is covered for the full term of services needed. And if there's an extension that's required, then we'll go ahead and extend the single case agreement as needed. Any questions about that process?
I'm watching the questions box and I don't see any, but I have some questions. So maybe I'll speak my questions and maybe they'll jog some other questions.
Sure.
So my first question is, I understand that you need a single case agreement, which is that authorization to see a provider outside of the network. And that's basically a prior authorization, and it goes to review. How long does that review process take? What should members expect?
The typical review process is usually around 14 days. However, we frequently work on cases depending on the member's needs. So that is kind of why the recommendation to work with case management to evaluate the unique member needs that are necessitating the single case agreement. So I can I'll use some brief random examples where a member is relocating out of to a new area and wants to continue to see their provider for a period of time, or some pre-scheduled appointments. in general, continuity of care should cover that, but sometimes providers want items in writing to support their billing processes. So that would be a point of contact where the member would explain their particular situation, and case management and utilization management can lean in to work with the provider to get the necessary documentation submitted for review. There could be an urgent referral for a child that needs services outside of network, and that would also involve, contacting all the providers and making sure everybody's on the same page and expediting it through the process. And then a typical expedited process would take around 3 to 5 days.
So can you say again what the non-expedited process timeline is expected to be?
14 days.
That's what I thought you said. Okay. And how does one mark it as, and then an urgent referral is more like 3 days.
Mm-hmm.
How does one get it marked urgent?
There's a box on the form.
Gotcha. Okay. And then if somebody's out of their area, my understanding is that emergency room services are covered in the US, not outside of the US. What about urgent care? Can somebody go to urgent care and have that be covered? What does that process look like?
Is the question urgent care outside of the U.S.?
No, I'm sorry. Urgent care outside of the region.
So if it is emergent outside of the region, then we should be following the emergent rules. And maybe I'm just not understanding the question.
So yeah, sorry, I'll try to be more clear about what I'm intending to ask. If somebody's CCO is Trillium and they're in Medford and they go to the emergency room, that is expected to be covered because they have an emergent issue and they must go to the emergency room, correct?
Right. Mm-hmm.
Okay.
Yep.
There are also urgent care places where you can go for urgent care that isn't emergency, but it's also not getting, set up with a certain provider. So it's sort of that middle level of care. I'm wondering if you can speak about urgent care clinics and if those are covered outside of the region or what needs to happen for them to be covered. If there's something that is more urgent than 3 days, than that 3-day process you were referring to.
Yeah, I think we'll have to take that question back and follow up on that one, just because of the question of the urgent care and the requirements of emergent being in the ER, right?
Okay.
So we can take that question back to our benefits team to get clarity for you.
Thank you.
Or clarification, sorry.
Okay, so hopefully
urgent care is usually a little bit more tricky because they're set up specifically with or offshoots of hospitals and such, and EMTALA rule would require that anybody who needs emergent care is seen regardless of insurance benefits. It's an insurance blind rule, where urgent care is slightly different. So we'll confirm that.
So somebody cuts themselves and they need some sutures. They don't necessarily need the emergency room, right? They need 3 stitches in their finger. That to me would be an urgent care need.
Right. So
that's the,
I mean, yeah, because I think some of this is dependent on if the urgent care is required to see them, right? And so I think that's what Lauren was referring to a little bit there. As far as coverage from the health plan perspective, I believe, Lauren, that would be reviewed on the authorization of determination if it was urgent or not, and then if there would be coverage for that. But I'm unsure of the requirement from the provider's perspective to see the member.
Correct. That's the piece that we'll need to hammer out, because in general, we would hope that no provider would turn away a member, but we don't want to also have a blanket statement.
Yeah, and I think I understand that you can only answer questions about the CCO piece of it, right? Which is, when do things get covered? How do people access that care? And of course, they have to go to a doctor that will see them. I'm hoping that that discussion opened up some other questions from folks, so I'm watching the questions box. I do see a question and I think she was trying to help me figure out what I was saying, but strep throat, for example, which is pretty urgent, like strep throat can be really, really bad and debilitating. Let's take that as a case example. Somebody feels like they have strep throat, right? Incredible pain and other sickness. How do they handle that when they're temporarily away from their region?
So a great option for Trillium Community Health Plan members would be the telehealth access. So we have a 24/7 nurse advice line that all members have access to, and that will connect to an actual on-call physician that could, in that case, do an assessment through a telehealth visit and could actually get prescription associated with that, strep throat situation. And also could refer or do a triage assessment if that person does need to go to, or seek emergent care, as in go to the emergency room, or can complete some lower level of care support and call into their PCP at a later date. I think so. That's a great option. And then also, I think COVID-19 emergency has opened up some unique doors with primary treating physicians' offices to offer telehealth visits for their established members. So that can be another option. So there, again, no wrong door with Trillium. There's lots of options available. And, if someone is in an emergent situation, always advise, seek emergency care, as soon as possible. But those are some other valid options as well.
So I have one follow-up question from that before we move on to HealthShare, and then we'll take questions for the two CCOs. And so in this telehealth environment, the telehealth scenario you just mentioned, does that person need to be in Oregon in order to be covered for telehealth with their Trillium provider? Do you know, or is that a follow-up question?
They just need to be calling in via their plan and be covered by Trillium.
Okay.
Because we do understand that folks are intermittently out of coverage service area for a variety of reasons.
Great, thank you. All right, well, we'll keep watching the
folks that are, and I'll just kind of say folks that are out of area, visiting, can always also seek medical emergency room at any hospital facility in the country. And the EMTALA rule would apply to that. So if a member was in California or Louisiana or Texas or wherever, they can always access the emergency room.
Thank you. All right, we'll continue to watch the questions box, but right now I'd like to pass it over to HealthShare to talk, and the team present your information, and then we'll take more questions.
All right, who's got the slide? Oh, look at that.
Bling.
Oh, look at that, that's awesome. All right, this is Talk again, Sonali Gillespie, she, her, hers, and I'm the Director of Community Health over here at HealthShare. And we do not need to go through all of the slides at all. Who's playing the slides for us?
Liliana.
I am.
Oh, thank you, Liliana. Can you go to the operating model slide? I don't know what number that is. I'm sorry. Keep going. Keep going. Sorry, we're going to have to put people through this. Oh my gosh, there's a lot of clicks. Slide, there you go, slide 7. Yeah, before I talk about single case agreement, I think it's important to kind of just ground folks again on the HealthShare structure. So for those who are new or those who just need a reminder, HealthShare is the CCO and OHSU Health, Legacy, Pacific Source, Kaiser, Providence, and Care Oregon are our 5 health plan partners. And you can go on to the next slide. Sorry, you can go to the behavioral health slide with, if you go back to the one, Liliana, sorry, right, is it number 9? It's 12. There we go. So for behavioral health, I want to focus on that one for single case agreement. Care Oregon manages this benefit for Health Share and for all of our health plan partners. They manage this for the entire Tri-County area for those that are in our network. And what that essentially means is if somebody is interested in going to behavioral health provider that's outside of the Health Share network, they can really just contact Care Oregon, and they will work with you on getting a single case agreement. And the other thing I do want to really emphasize is this central piece of working with the care coordination team. But before I go there, I just want to go back to this slide that Liliana has up. You can turn the member ID card around and you can see, go ahead and click right there at the bottom, right, is the number to the behavioral health line for Care Oregon. And these are just some of the things that are covered. It goes back to what Trillium was talking about, like the no wrong door, right? And I want to just continue to emphasize to call this number. And there's so many different situations, and the folks on this team, our behavioral health team, can really help answer a lot of the questions around single case agreement. But the other piece that I get really excited to talk about is our care coordination team. And I believe that might be 2 slides down. Sorry, Liliana, I sent you the most updated one, but I don't think you may have gotten that one. Keep going. Look at all this fun stuff. There you go, slide 19 and 20. There you go. So here at Care, or not here, but at Care Oregon, this is what their care coordination team looks like. Providence, Kaiser, OHSU, Legacy, have also their own care coordination team. But again, if we're going to focus on behavioral health, single case agreements, it is contacting either the number on the back of the card and asking your question or asking to be connected to the care coordination team. And as you can see, it's a multidisciplinary team, and these are the folks that can really help make sure that your needs are met, whether it's a single case agreement or whether you need to get medications outside of our network, or if you're out of state. This team is really the team that can really sort through so much of those, like countless situations, if you will. And I know care coordination is a term that is often used in the health system, and we don't do a great job explaining what that is. And here are just some examples, again, of why you would call a care coordination team. A question that I often get is, well, what if my physical health is with Providence? How do I get behavioral health? And I go back to saying it is contacting Care Oregon, because they are managing that contract for behavioral health. For example, if you live in Clackamas and you want to go to Garlington Center, right? You can go there. It doesn't matter what county you're in. I don't know if that's making sense for folks, if that's landing. Do we have any questions, Deanna?
We don't have any questions at the moment. So I'll let you keep going, and then our team can ask some questions, and while we give people a chance to ask their own when you're done.
Yeah, you have some excellent questions. I was like, oh, what are those questions? How do we answer those for Health Share? Liliana, do you want to go back down to go to the very second to the last slide? All the way down. Oh, go back up. Oh my gosh. There you go, 27. You are fast, Liliana. So yeah, again, just a reminder to folks to call your health plan. You turn that card around in the back and call those numbers. It is really the easiest route to ask your questions. Again, whether it's single case agreement, getting transportation to a provider that might be up in Seattle where we don't have one here. I don't want to simplify it, and sometimes I think we have to, and saying call these numbers on the back of that card. That's it for me. Until you start throwing all these questions at us, Deanna, go for it.
Well, you know what I find in my brain where it's going. So what I'm going to invite people to do is think about a scenario. Do you have clients who find themselves in a certain scenario? And maybe you can pose that scenario to the questions box, and we can run it through HealthShare and Trillium to say how, in this sort of case, it's a question of how do they access that care, but also things like what is the timeline, what are the restrictions on it being, covered. So, and there are there's maybe 3 pieces here, especially for HealthShare. There's the physical health, the behavioral health, and the prescriptions. So I'd like to know which one of those you'd like us to delve into a little bit, and scenarios might be a good way to do it. So I'm watching the questions box, and I think, and while I'm watching the questions box, a good scenario might be something like, I have horrible strep throat. Waiting 3 days can feel like an eternity. And maybe you can also speak to the telehealth options available through HealthShare, and if we expect those to continue past the COVID-19 emergency period. And any of these questions you can't answer, of course, we'll take back and answer later, so don't feel too pressured. So do you want to speak to telehealth?
Lauren, I just want to call. I just wanted to call it one quick thing of the urgent care doesn't necessarily need a single case agreement. So that's the piece we're gonna carve out for Trillium through our provider network. So in the strep throat scenario for Trillium, I wouldn't recommend someone waiting 3 days for a single case agreement to see an urgent care. I would recommend that a member community provider go onto the website and see if there are any in-network providers in that area that could support that moment. And I'm actually whipping up a quick slide deck that will give some links, and I can share that out through Masara. But it'll give the links, and it will give all the items that I talked about, because I figured probably better to have a written resource.
What I think I just heard is that at least Trillium and maybe HealthShare might have in-network urgent care providers that are outside of the service region. Is that what I heard?
It is potential, because folks have relationships through different provider networks. And we also have different service areas, at least for Trillium, being in Lane and Coos as well. So there are opportunities where we do have contracts in place. So not 100%, in network, but always that's the first kind of line of defense to go and take a peek and see if there is anybody in network.
So let's say somebody's in Virginia, and chances are you don't have a contracted urgent care place in Virginia, right? Urgent care provider. So they go to the urgent care. They don't have anything available. So they go to urgent care because there is a really immediate need, really, really sick, but not emergency room sick. How do they work? How do they make sure they're not going to get billed and be responsible for that? What is that process? Maybe Trillium, you can answer first, and then HealthShare.
Sure. So any out-of-state emergency room visits, if you or emergent visit, taking your Trillium ID card with you, and as HealthShare pointed out, the ID card with the numbers on the back when you travel out of state. Make sure that member is presenting the card as soon as possible, and they have the opportunity to say, "Are you willing to bill my Medicaid insurance?" There are absolutely times that they are not going to bill insurance. However, what the next course of action would be is contact Trillium and discuss the situation, and through customer service, and just as HealthShare pointed out, through the numbers on the back of the card, because Trillium is able to speak with the provider's office and work proactively in trying to either get a single case agreement or come up with billing opportunities. However, if a member does receive a bill, sending that into Trillium and working with Trillium to get that information, handled is the best case scenario. And I do, in the slide deck, I am going to give some information about that as well. So we can't guarantee they won't get a bill, but OHP covers emergency and urgent care anywhere in the United States, but not outside the United States.
That's what I was looking for. OHP covers emergency care, and urgent care anywhere in the United States. So if a member goes to an urgent care clinic out of state, and the urgent care clinic can't bill directly for some reason, they should then submit that bill and work with the CCO to get it covered.
Correct.
Thank you. HealthShare, would you like to address that same question and add anything to that summary that I think I just heard?
2 thumbs up to what you just said, Deanna. Yes, you can go to any emergency room, urgent care. And for those who it feels a little scary, right, because of the bill question that you asked, I would again call your health plan before going and saying, I just want to make sure that I'm good, right? Can I go here? And if they do end up getting a bill, because we know that often happens, even if it's approved, we, in our experience, have paid out-of-state bills often, if not all the time. But again, if you get a bill, I would encourage you to call your health plan. That care coordination team will really help sort through all that. You shouldn't have to do that on your own. I mean, my biggest thing is like, call your health plan, call your health plan.
Okay, but
Yeah,
that's very, very helpful.
I mirror that. I mirror that as well. Call the health plan, call customer service, call case management, because we're here to help members navigate very complicated health systems. Even for it's difficult to navigate health systems even when you're savvy. So that's what we're here for, and that's the support we provide our members and our providers.
Mm-hmm. And if our member does
ask about the bill, like you'll see it. Oh, I'm sorry.
Yeah, I was just, this is Randy. I was just going to add, if our member does receive a bill or has questions about it, we work with the provider directly to get the claim processed for them. You know, we have to get them enrolled with a DMAP number, et cetera. So we work with the provider to get those claims processed as needed once we hear from the member and or the provider.
Yeah, Brandy, that's exactly what I was going to say. We actually don't even bother, if you will, the member. Once we see the bill, we work through that with our provider network or outside network.
Yep.
We sort through that.
Yeah,
so the burden
like
isn't on the member.
Yeah, sometimes we'll, find out about it, from the member, but then we just reach out to the provider from there.
Thank you. I'm looking for any more questions or follow-up questions about that. If anybody's had experience with that and that's not how it's worked, we'd like to ask the same questions about prescriptions. So let's say somebody's in Virginia, we'll take that same example. They have strep throat and now they end up with a prescription that they need to fill and there aren't any Walgreens or wherever they've gotten their prescriptions in the past, right? So they've gone through that first tier of, okay, I'm looking for the same chain. We don't have the same chain. What does that process look like?
This is Brandy. So we would, instruct that member to contact our health plan, and then we would work with that member and where they're located and work with them to get the prescription that they need with a pharmacy in their area.
All right. What if they don't know that, right? So they go to the doctor, they pick up their prescription, they have to pay $56 for it, and now they realize, oh, I shouldn't have done that. I bet that could have been covered. So they call their CCO. What does that process look like?
Again, I think, the member would call in, we would work with them, the member and our pharmacy benefit manager on that.
And
Same for us, Deanna.
So it's possible to get reimbursed for something if you didn't get that pre-coordination.
I think it depends on the situation, right? If it's emergent, not. But those would be situations that we would work with our members and our pharmacy benefit manager on.
And the only piece of advice that if a member does pay, just keep a copy of the receipt so if it does need to be submitted and there is a reimbursement opportunity, that they have the bill available.
Okay.
Yeah, we have definitely reimbursed members in the past. It's very situational, but we have had times where members have paid, maybe they didn't understand the benefit or just a different situation, but we do have processes in place to reimburse members as needed.
Thank you. This is a little bit of a side question, but I'm going to ask it anyway. This is somebody asking about cards with pre-loaded funds to purchase eligible over-the-counter items at pharmacies. This is something that's available for Medicare clients. Is there anything like this for OHP members?
We don't have that at we don't have that at HealthShare, but I'm so happy though whoever asked that question brought up the OTC card for Medicare.
Yeah, it's a great program. Trillium, can you speak to that at all?
Lauren, I'm not aware that we have something like that. But if other CCOs do have that in place, I think that's something we'd be very interested in learning about. I haven't received any information on that from a Medicaid perspective.
And I think part of that is because Medicare does have an allowance for over-the-counter items, but I don't believe that Medicaid does. I don't know if there are over-the-counter items that are covered under OHP. So,
and I think it would be very specific related to the medical condition that the over-the-counter item is trying to fulfill. So, going to the pharmacy, there are a plethora of over-the-counter items that you could purchase, but really, what is it to correct a health condition that is medically appropriate? Right. So that would be the first line of defense for any over-the-counter prescription or over-the-counter non-prescribed items for coverage benefits. There are times that we have covered those under flexible service options, but it really depends on each situation very specifically. Is it a pack of Band-Aids? So that's kind of general, or does it go into something more supplemental like vitamin D, or is it, like wounds salve like polysporin or neosporin? So there's so many different options that it would really be dependent on the needs of the member. And the best case scenario for those is to work with care coordination and through customer service to get connected to care coordinators to see what that unique situation is versus a blanket, everybody gets a $25 stipend or something like that.
Yeah, no, absolutely. I think Lauren just had the important fund there is no preloaded card, but the avenue of funding would be through our flexible services for that, for those services.
All right, so I'm going to ask a follow-up question. Let's say somebody is getting some sort of over-the-counter item or product covered through the flexible services program, and they are now out of state because of being displaced for some reason. Are they able to get those items covered even if they're purchasing them out of state? Does that process lend to anything different than if they were in state? It's a little bit.
The process would be no different, especially if it was a temporary situation. So the member would contact customer service or their assigned care manager and work to rectify that situation. And I mean, there were several instances this summer during the wildfire events where there were many members displaced for long periods of time and even more semi-permanent displacement due to loss of housing. And, members who lost DME equipment or medical items, we did work with each individual person to make sure that they were getting replacements for what they needed for their current situations and for durations that were appropriate based on their reallocation.
Okay.
Relocation.
Right.
An example would be if someone relocates to California for 6 months per se, we may want to look for opportunities to work with OHA to actually get them reassigned to a California Medicaid plan because that's better for continuity of care if they're there for an extended period of time versus someone who's traveling, just and happens to have lose their medication bag or something like that.
Thank you. So I am not seeing other questions in the questions box. So I'm going to summarize by saying that it really sounds like the big picture for me is that emergency care and urgent care is covered anywhere in the US. And in order to get other care besides that, people need to get single case agreements, either on a non-urgent timescale or on an urgent timescale, which is more like 3 days. And getting prior authorizations and these single case agreements for those other services, they would call the customer service or possibly the care coordination team to arrange for that and to discuss it. That's the big picture of what I heard. Did I get that right?
You nailed it, Deanna.
Okay,
Your
good.
your questions though were throwing me off a bit, and I'm just like, nope, just
Excellent.
keep it consistent. Call that health plan. Call them. They will help you. They are there, waiting and willing. In fact, they're excited. When I was at Care Oregon, you know, I'm always trying to encourage people to call that number. And if you don't have a card, we can get you that card. We can even get it online.
Okay, thank you. And then the other thing that I heard is that if somebody's going to have an extended stay for several months and they have ongoing care needs, that they should contact their CCO, and there may be a decision or a movement or support to get them signed up with the local health coverage option or Medicaid option if that is in their best interest.
Yeah, that care coordination team will really look at what the treatment plan is, and they'll work with the provider, even if they are out of state. That might be the best option, and they'll work with them to figure those pieces out.
Okay. Well, thank you. I would like to post whatever information you folks have for us onto group site. I will also take any questions people are going to put into the questions box. We can also post those answers. So thank you very much for all your information. And I think we appreciate you being here.